Hello, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. You can see all of our wonderful expertise and all of our wonderful partners that we've got here today. I'm super excited. There's a lot of really great information. So we're going to go into it. So we've got Danielle Lederer, Chief Epidemiologist for Genesee County Health Department. She's going to be talking to us about syphilis rates in the community, what that looks like. Dr. Harris is going to be talking to us about her Mindful and Motivated Youth Summit. Then we've got Dr. Heather Lynn Uphold, Blair Warren, Dr. Dick Sadler talking to us a little bit about their health equity report card. And we've got our amazing people, Yvonne Lewis and Dr. Wolford, who are from the HFRCC and are going to talk to us about the research symposium going up. So we've got really great information to share with you, and I'm excited to get started. Dr. Harris, you're going to talk to us a little bit about your summit that's coming up.
Yes. Okay. I'm going to, can you hear me? Yeah.
Yes, we can hear you.
So I'm going to share, can you see this PDF?
Yes, we can.
Okay. So I'm excited to talk to you guys about the Mindful and Motivated Youth Health Summit. And so this is a free summit event that's happening for teens at the Michigan State College of Human Medicine in downtown Flint. So this summit kind of came about with, I guess, two desires. One, for students to kind of get more access to health and medicine, as far as kind of building that or building that pipeline and pathway that we have into health professions, as well as expose some of the students to just some self-care potential things that they can kind of get involved with as far as taking care of themselves and their mental health. And so this summit, I'm really excited about it because I was able to bring together a lot of local health professionals. And so my goal with kind of contributing to that pathway and nurturing our teens is that they don't just go into nursing and being a doctor, that they look at the technicians, they look at the massage and art therapists, they look at behavioral health specialists, they look at some of our caregivers, some of our managers, because across the board, we just have shortages. And so the more students are exposed to the diversity of the health field, the more they will hopefully go into it. And the more some of them will hopefully come back like I did. And so this summit has a lot of components. The first thing you can see is the mini medical school sessions. So myself, as well as Dr. Dara Dim, who is a neurologist at Insight, will be talking about, well, she'll be talking about neurology in the brain. I'll be talking about kind of heart health and our cardiovascular system, teaching the students kind of how the heart works as well as how the brain works. My hope is that this summit eventually kind of grows into a yearly thing as well as a mini medical school in our area. But this is the first kind of iteration of it. There'll be a teen health seminar with the Genesee Health System, bringing one of their specialists, just talking about mental health of the students, as well as kind of the teen confidentiality laws that exist they exist across the country, but the specific ones that exist in Michigan. There'll be a healthcare panel with Dr. Mari Young, Dr. Jerome Adams. Well, Mari Young is a OBGYN doctor here. There'll be Dr. Jerome Adams, who is a physical therapist here, who owns his own physical therapy company. There'll be Dr. Baika Smart, who's a public health specialist at MSU, and Dr. Aaron Cooney, who is a pharmacist, also here from Flint. So they will be talking about kind of how they got to where they are, as well as answering questions from the students. And again, this is kind of a piece of one, showing that there are a lot more different types of doctors than the medical doctors, but also giving the students a way to kind of see actual professionals in their community that they can just talk to, and it's a tangible, direct kind of interaction. The self-care spaces, I've gotten local yoga therapists, massage therapists, art therapy, as well as a healing circle going for the students. And so they're going to have a lot of information they're going to get throughout the day, and then it's going to kind of narrow into this like self-care kind of moment before they transition back to their regular lives and their parents or guardians pick them up. I have Nurse Nicole from Hurley, who will be doing a sample CPR. Like we all know that CPR training is very long, but this will be a sampling with some kind of CPR dummy. So they'll at least get that exposure with hopefully being able to bring them on or bring them back to eventually getting a full CPR training as far as that whole kind of day course. But they will all get the Stop the Bleed training, which is only about 50-minute training. And so they'll have that certificate. And those who don't know who Stop the Bleed training is, it's basically kind of like tourniquet work in the field, kind of trauma work as far as being able to control some large bleeding before they're able to possibly get to an ambulance or some other kind of medical services. So this event has been sponsored by a lot of people across the board as far as the recast with the Health Coalition, GHS, Hurley themselves, Mothers of Joy Institute, the Genesee County Prevention Coalition, as well as Donations with Love and the Ruth Mott Foundation and MSU College of Health Medicine, the LMU program. And so like I said, I'm really excited about this. It's going to be happening in about a month on a Saturday. All teens 13 to 19. The focus is Flint and Genesee County, but as kind of things go on, it may open up more just because we have capacity for about 50, 60 students. And I would love to get as many students kind of exposed to this. They will be getting kind of an opportunity to talk to different people, whether they're in the summit or kind of at our vendor tables, where they'll just be able to be exposed to all the different kind of routes you can take. I can't get all the health careers in there, but at least make them start thinking about direct or indirect patient care, whether it's technology stuff, research stuff, actually seeing patients kind of in the clinic. And so just kind of really trying to nurture their interest and see if there's a lot more students that may be able to go into health and medicine if they were just exposed to a little bit more. I will drop all these flyers that I'm going to talk about into the chat. But you can use the QR code or go to the Hagerstown Health website and /Youth Health Summit to sign up any students that you know. The registration is going to go up to probably at least the week before, just because we all know planning and food. But I want as many students to be able to join as possible. And hopefully if there is over interest, I'll be able to bring this back sooner than later. But I am really excited about the Youth Health Summit and kind of how it's been brought together and all the people who've been able to support it. There's a lot of health professionals here who really do want to mentor and share information with students. And this is able to kind of bring them together from a lot of different companies and organizations. So I am really excited about this. And I'm looking forward to it. Well, it's a lot of planning, but I'm looking forward to just sharing information with students because it's all about the health literacy and health education aspect. So that's my personal event that's coming up. But the other two things that I want to talk about are things that I'm also just excited about as a family medicine doctor. So this is an event that is happening tonight at 7. The Black Knights Brown Hope event is put on by Recast and Reach from the Greater Flint Health Coalition. July is the BIPOC or Minority Mental Health Month. And so we know that minorities have decreased access to mental health, or even for Blacks specifically, only 25% access and get treatment for their mental health concerns. And so this is just highlighting and kind of emphasizing the need for more access, but also the need for us to come together as a community and support each other. So Mama Soul is going to be doing some spoken word. If you haven't heard her do spoken word, it's very motivational and inspiring. She's crafted her skills and has become a really great and inspirational Flint native that speaks to the youth, speaks to adults of all ages. They're also going to have just general kind of speakers and just ways for us to fellowship and reflect on ourselves. And so this event is at the new McCree Theater. So if you haven't been there, it's on the north side of Flint off of Clio Road. It's a very large previous church that's been converted to a theater. They also have other events, not just associated with this, but the event is $10. You can pay at the door. But it's going to be a great way to just come together and support mental health initiatives in our community, especially for July's Minority Mental Health Month. The other thing I want to talk about, which I've been waiting for this since I heard about it, is the Real Bodies exhibit at the Sloan Museum. If you haven't heard about the Real Bodies exhibit, they're literally humans. They don't smell like an anatomy lab, but they've been kind of formed or contorted into just great visual like positions and stuff. And so you can see the different layers from the skin to the muscles to different organs. And it's a way for people to really see the beauty of the human body as well as the complexity of it. This has been across I want to say across the world, but I know it's been across the country. I know Detroit had it some time ago, but this is right here in our community until the beginning of the year. Because this is such a special exhibit, it doesn't come with the free Genesee County discount that we all get as far as being able to go into the Sloan for free. And so there is an $8 fee for adults. And I believe the children fee is like $5 or $6. But considering like the Flint Cultural Center is completely free for all of us who live in Genesee County, this is a small price to pay to appreciate this exhibit. And so if you have time from here to January, I definitely think that you should try and go see the Real Bodies exhibit because it's probably not going to come back here for a really, really long time. But it's a great way to appreciate the human body, whether you're someone who works in public health or works as a clinician or just curious what something looks like. And you're like, I don't want to just look at pictures on Google. I want to see it in real life. They've been preserved amazingly, and you're able to appreciate all the detail and the beauty of the human body. I haven't done anatomy since medical school, and so it's not something I want to kind of reflect back on, but I am excited about seeing the beauty of the human body through the Real Bodies exhibit. So I definitely encourage you all to go to the Sloan, really go to all the Flint Cultural Center kind of pieces, but this one specifically because it's health related, I've been really excited about it. This is actually my flyer I got off of my refrigerator when I picked it up back in, I don't know, January, December. So I've been waiting on this for a long time, but think that everyone in the community should really get a glimpse of it because it is a great opportunity to appreciate the human body. That's all I have.
That's all?
That's all I have.
That's all? How are people supposed to follow that? I want to circle back really quickly because I think you made this Mindful Motivated Youth Health Summit where you're exposing students to healthcare careers. And then you followed it up with this idea about Black mental health and needing healthcare providers, et cetera. And we know, right, that the data on disparities suggests that we really work on disparities when we have some sort of concordance, when you have the opportunity to see a provider who looks like you or who has a similar background, our disparities data really improves, right? We see better outcomes in patient satisfaction. We see better outcomes in patient communication. Part of why I think the work that you're doing is so important is part of the work I study is how we get people from communities into medical schools and into healthcare fields, right? People who understand the community context, people who are from communities. It's part of the work that we do in the College of Human Medicine, right? We're in 8 different communities across the state. One of them is Flint. So you having this in our building, having this event that really highlights bringing kids from the Flint community in to understand, be exposed to healthcare careers so that eventually, as you said, right, they end up potentially like you, where maybe they become a physician who comes back and opens up a practice in the community. So huge shout out to you in this work because it's so important and it has so much tangible outcome. So thank you for all the work you do.
No, thank you.
All right.
I'm excited for it.
Yes, super excited. Danielle, I don't know, Danielle's like, so I got to follow that. But Danielle, you are also talking about some really important information in the Flint community as well. So we have heard a lot from Nurse T, a lot from different people in the community, like what's going on? We're seeing an increase in syphilis, particularly in our elderly populations. And you are kind enough to bring your expertise to talk to us a little bit about what that means, what that's looking like, and what we should expect from that. So thank you so much for sharing that with us today.
Yeah, and I just want to give another shout out to that Real Bodies exhibit too. That kind of paved my way into going into health and public health and science when I was really small. I remember seeing it many moons ago when I was just, I think, in grade school. And I can only imagine what they've done to make it an even better experience. So please go to see that.
I'm so glad you said that because in my head, I was already like, okay, I got to take my daughter to this exhibit, right? So maybe she'll follow in your footsteps.
It's fantastic. So I'm going to go ahead and share my screen. I'm going to talk a little bit about syphilis. Syphilis on the rise in Genesee County. A little bit about the symptoms of syphilis, just encouraging you to go and get tested, and then talk a little bit about the epidemiology of syphilis in Genesee County and the state. So I'm going to expand this. Okay, so what is syphilis? Syphilis is a sexually transmitted infection that can cause some serious health problems without treatment. It develops in there's 4 different stages of syphilis, and each stage can have different signs and symptoms. So when we think of syphilis, what we're really trying to look at is primary and secondary, because in public health, that's what we can really, and in health care, see the signs and the symptoms and try to target it before it gets to these latent and tertiary phases that can result in things like neurosyphilis, more severe, full body responses to the infection. You can get syphilis by direct contact with a syphilis sore during vaginal, anal, or oral sex. And it can spread from a mother with syphilis to her unborn baby as well. So when we're thinking about syphilis, during that first primary stage, that's when you might notice a single or multiple sores. They're often painless and they can go missed. And that's why oftentimes we have people who come and get tested more so during that secondary stage of syphilis, is because they're missing that first stage. It's painless, might just seem like a little sore. And that sore, that can occur in the penis, the vagina, the rectum, or around the lips and the mouth, inside of the mouth. And syphilis is known as the great imitator. It is, and a lot of healthcare folks know that phrase, but that might be new to some of the people in the public. And it's because it disguises itself in various forms of symptoms. So symptoms of syphilis can include things like fever or swollen lymph nodes, some patchy hair loss, sore throat, headaches, weight loss, or just a generalized like rash. And that's why it can often go missed, especially once it hits that secondary stage of syphilis. The symptoms will go away with or without treatment. But the issue with that is it will progress to like latent or tertiary stage of disease, that neurosyphilis. So it's really, really important to get treatment for syphilis early on, and to go get tested if you're seeing any symptoms like a sore anywhere, or any of those kind of secondary symptoms that we were talking about, the rash, fever, headaches. Seek healthcare and get STI testing. So without proper treatment, early syphilis symptoms fade, but the infection remains in the body and can cause irreparable damage. I've listed here just kind of some of those stages, and where the infection, like how the symptoms appear, what typically presents, and then the course of disease. So you can see that below. But really what I want to say here is people are surprised that sometimes this little sore is painless. They're not really alerted by it, and they don't seek testing. So what I want to say for this is it's really important to be an advocate for yourself. If you're going to get tested for STIs, a lot of the times people just get tested for chlamydia and gonorrhea and trick. And so please advocate for yourself and say, I want to be tested for syphilis as well, because we are having an increase in our county. And so we have had one of the highest rates of syphilis we've had in actually over a decade in Genesee County. We've seen 122% increase in primary and secondary cases of syphilis, and then a 92% increase in overall syphilis. And we've continued looking at this data. Again, we are actually just going to release some June and July data, and it looks like that increase is continuing, and actually at an increased rate as well. And so it's really important that we let you guys know about it, alert the healthcare providers, which we have, and just make sure that this is a full team effort into one, recognize that if you're having and living a lifestyle where you're having multiple partners, please go and get tested and include syphilis and mention syphilis for yourself. So what I do want to mention is that we've seen an evolving change of epidemiology in syphilis. While men that have sex with men continue to account for the largest portion of syphilis cases, primary and secondary cases, in Genesee County and in Michigan, we've seen a significant increase in the heterosexual men and cisgender women population. So we've seen an increase in that, and that is concerning because that's where we start to see increases in congenital syphilis. So very important to note that this is not just affecting one population. We're seeing an increase across the board. The highest increase we're seeing is also in Black men and individuals who are 20 to 29 years of age. So really important to note that too. Again, though, that syphilis increase is across the board. So syphilis is treatable, and it is actually easy to treat once you do it early on. So please make sure to get 1, tested, 2, treated if you do have syphilis, and then to also inform people of your contacts if you are aware of their names. So please make sure if you're working with public health, just to let them know it's always anonymous. And public health works with you to get people treated. So if you don't know where to go to get tested, the health department at the Burton location does screening, testing, and does contact tracing. So we have those services available to you, and that's our Burton location. So this is just a graph, real quick one, of our increase. So this is looking at a few month time span before the increase and then kind of after. And when we zoned in, we're also seeing just the 76% increase in primary and secondary. That increase is being primarily driven by our secondary stage. As you can see in the second half of this graph, we're seeing those spikes. And again, it's actually increasing. So, and then this is just to state that we've seen a 48% decrease in STI testing amongst syphilis cases. So again, key is please go and get tested and advocate for yourself to include syphilis in testing. And especially if you're living a lifestyle with multiple partners. So yeah, that's it. That's all I have for today. Just want to make sure you guys are aware of this increase, and we're going to keep you guys up to date on this increase. But yeah, if you guys have any questions, please let me know.
Thank you so much. And it's interesting that you said, people will get tested for gonorrhea, chlamydia, often trichomonas, but syphilis seems to fall by the wayside. Have you had any feedback on why people are not thinking about syphilis?
Yeah, I think it was a long time ago, we thought we almost eradicated syphilis, right? And we haven't seen these cases, a little bit more of a rare STI. And it's just, this is a nationwide trend we're seeing. And it's not the first thing that people think of, because again, it's the great imitator, that's syphilis, right? There's so many things under the sun. And so it's just about starting to include it again in our testing. And so please advocate for yourself. Yeah.
I think that feels so important too, because the other comment that or trend we've noticed is that certainly it also occurs in older populations, right? And some of this is stigma, right? We have convinced ourselves that for some reason we don't need to ask our older populations if they're sexually active and how they're protecting their sexual health. And even it's something that I have to talk to my residents and medical students about, right? Like, people don't turn 60 and stop being sexually active, and we need to make sure that we're asking people about that. So I really appreciate your comments around, one, people need to advocate for themselves. But as I think about our other sort of healthcare providers on our panel today, we've got to make sure that we're encouraging our colleagues to make sure that we're screening for sexually transmitted diseases in all populations, right? Super appreciate your expertise today. Thank you so much. All right. We have some amazing people here today. I'm so excited to have Dr. Wolford and Yvonne Lewis here to talk to us a little bit about HFRCC and the Research Symposium that's coming up. Thank you both for being here with us today. Oh, Dr. Wolford, you're muted.
Just brilliant unmute. Thank you. Okay, thank you so much. I'm going to share my screen here, if that's okay, so we can highlight some information about our upcoming symposium, and we are incredibly excited about it. So here we go. As was mentioned, we are here to talk about the 2023 HFRCC Research Symposium. And so this is going to be our 6th annual symposium. I can't believe it's been that many years. Yvonne, we were surprised as we counted back. We started in 2018. Twice we were in person, and then in 2020, when we were 2 weeks before our symposium, which was supposed to be in the Flint FIA, the pandemic hit. And while that has been dreadful in many, many ways, there was one slight, we should say, a good thing that came from it, which was that instead of doing the symposium that year, we started the webinar, which has gone on since then, and which you guys have taken to the next level, and it continues. But now, of course, because we can meet in person again, we have gone back to the in-person event. We had an in-person event last September. Unfortunately, I had to enjoy it remotely because I got COVID that week from my husband. And then, but it was an amazing success. And so we will be doing it again this year in person in Flint on September 29th. I'm going to hand over to Yvonne, who is going to tell us a little bit more about why you want to be there.
So we are inviting you to register for the symposium. Our theme this year is From Research to Action, Building Capacity and Building Partnerships. And one of the reasons that we are encouraging the symposium is that it's an opportunity to have community members and academic partners or anyone from across the community to share in learning about research. You've already heard this morning some really, really important information that was shared. And much of that is learned through research. You know, how do we know about the syphilis situation? And then, of course, even with what Dr. Harris talked about with respect to the different careers that are available, these are research opportunities. So we're encouraging you to register to come out. It's from 9:30 to 3 p.m. It's a full day, but so there will be lunch provided. So we want you to be sure to come out, but it's an opportunity to network. If you are interested in the field and just not sure, or if you're already working in, you want to talk to community members, or you want to try to find ways to engage more people in your research. From an academic perspective, this is an opportunity to network. For community members, it's also an opportunity to network and engage. Well, one of the things that we knew and learned even through the water crisis, before that, there was a lot of research going on out of community, and there still is. This is a good opportunity to come in and learn about the research and how you as an individual, how you as a community, participating in a community can be involved in research. So it's a learning opportunity, it's an engagement opportunity, and it's also a network opportunity.
Awesome. And so we are incredibly excited about all that we have planned for the day. We have keynote presenters here. In the afternoon, Dr. Mona Hanna-Tisha and Dr. Luke Schaefer will be presenting along with their colleagues. As you know, if you've come to the seminar or to the symposium in person before, you know we have book giveaways, and so we'll have that again this year. And we'll be giving away a book that was authored by Dr. Schaefer. We have other keynote speakers, which we will announce in the upcoming week, weeks. But this coming week, we have a very important deadline that I want to draw your attention to, that on Monday, the deadline, we hit the deadline for submissions for abstracts. So if you are part of a research project and you would like to present your project during the poster presentation, or would you like to be considered to be amongst our oral presentations, you need to submit the abstract for us, and the deadline is on Monday the 24th. Now, if you look at any of the flyers about this, it says 5 p.m., but we're going to take the liberty of extending that to midnight, because I'm like, who's going to be looking at it at 5 p.m.? So you have until midnight on the 24th to get in your abstracts, because we want to hear about all the work that's happening in Flint. We also want you to submit your nominations for award winners. And so we have awards for people who have worked in the community for many years and in research, and for academics and community members. And then we also have awards for those who are newly working in these areas, both again from community and for academics. And we also have partnership awards. So if there's a partnership that you know of there where people have made a distinct difference to the health of residents in Flint, you can nominate those members of that partnership as well. And so we are looking for your input, because this day is only a success because of you. So we really want you to attend.
Yeah, and I think it's important to note, Susan, as it talks about here, is that it's service as well as education. So there may have been some research opportunities for, in the various areas. So if you're in the area of education, if you're doing some service work, or even if you're doing some what we call rigorous research, it's still welcome. So look at those opportunities and join us, and please encourage others to share information with us about their projects, community activities.
Thank you so much. So you talked about a lot of really great opportunities that the Research Symposium allows, and you mentioned some really, two of your key speakers, and you've got a couple that you foreshadowed, and we'll hear about those later. Might have to bring you back to tell us all about those. But tell us a little bit about the work. We have some context for the work of Dr. Mona Hanna-Attisha, obviously related to the water crisis. Can you talk to us a little bit about the work of Dr. Schaefer?
So Dr. Schaefer heads the Poverty Solutions Center at the University of Michigan. So he does a lot of work about the impacts of poverty on health. And for example, was part of a book in the past about living on $2 a day. So how do you really, people who have to live on such stringent budgets, and we assume that everybody can make it and eat healthy foods and get to their doctor's appointments and do all the things that are required in order to live a healthy life. But of course, you can't do that when you have very, very limited resources. And so his work focuses on how we address those problems within our community and how it impacts health. So I think that we are going to find that he and Dr. Hanna-Attisha, because they're working together on a project currently, are going to have some really interesting work to present for us.
And I have some context for the work that they're doing together. I really appreciate you sharing with the group like how much their work dovetails and how much it's really important and impactful. Obviously the work of Flint RX Kids and thinking about some of those impacts, it's going to be an amazing opportunity to see Dr. Schaefer talk and give his context for what it means to really have to support yourself with very little income, and what that means in a healthcare context, what that means for all of the sort of social determinants that come down the line, right? Your ability to access care, your ability to get, trusted information, et cetera. So super appreciate all of your information about the symposium. Can we throw up the slide one more time just so we have the last details and people can remember? I like to remind people.
Absolutely, we can. Here it is. Because I really want to point out that we want this day to be equally as important for community as it is for academics. The only way that this is successful is if we have a good attendance from both sexes, and we are trying our utmost to be sure that it is accessible to everybody, that people can come and enjoy and participate in every part of it. So, for example, we have what we call our research docents, who are students who can help guide people through the posters and guide people through the day, who maybe don't go to research symposia all the time, and would like a little bit more assistance working out how to best get as much information from it as possible. Information is power, knowledge is power. And we want to make that information available to as many members of the community as possible. So thank you for this opportunity to share about it and for putting up this information again.
Research is power, information is power, knowledge is power, and you want to make sure that the community has access to it. I think those are like the ending points. That is exactly what the symposium is all about. And thank you, Dr. Wolford and Yaman, for sharing. Thank you.
Thank you.
I think sort of in that space, right? Research is power, information is power. All of these things are key. That is a perfect lead up to the work that Dr. Uphold and that Blair and Dr. Dick Sadler are doing in terms of bringing information to you about health in the Flint community through the Health Equity Report Card. And I'm so glad that you have an opportunity to discuss this today. So thank you.
Me too. I don't think it could have been a better segue from Dr. Harris to Danielle to our friends at HFRCC. Like it just was a perfect entrance. And Dr. EJ, I got to tell you, Blair and I and Dick and Moses and so many others have been so excited to bring the Flint and Genesee County, I feel like there should be a drum roll. Health.
We can do a drum roll. I got you.
I know. This has been a year in the making. So we're bringing to you the Health Equity Report Card. And I was reflecting on this, EJ, because it's so similar to what we do with the webinar. It's like you're thinking about something, you're like, oh my goodness, I cannot wait to share this on the webinar, like whether it's one of our speakers or in this case, the Health Equity Report Card. So it's been a fun journey and one that we are, if you haven't caught it already, one that we're excited to unveil for you today. So this is the HERC. I'm going to build it up a little bit and just give you some background on how we got to this point, how we created the Health Equity Report Card and why it's important. So what it is, we began to notice a couple things. So there is publicly available data in a variety of different places throughout the internet and variety of other locations. And what we wanted to do was put it in a central location, but also make it understandable so that it was something we could do something with, right? So what our Health Equity Report Card is a way for us to communicate the state of health disparities or differences in Flint and Genesee County using a report card format. The reason that this is important is that it helps us to address and identify the causes of the disparities and the inequities that are causing it and support the stuff that's going on to address those disparities. So the prevention efforts, the intervention activities, and where we're missing those activities, it allows us to add in extra support to address the disparities. For instance, sometimes we'll hear we're seeing an improvement in heart disease rates, or we're seeing an improvement in diabetes. So fewer people are being diagnosed with diabetes, but that's only part of the picture. What we need to understand is if there are differences between certain groups, or does it matter where you live? Because what we've seen is that sometimes one group will get healthier, they'll do a whole lot better, but other groups are actually doing worse. And that's what our Health Equity Report Card helps us pay attention to. On the next slide, we're going to talk about some definitions. You've heard we've kind of thrown around some definitions, and we want to just take a moment and so that we're all on the same page. So when we think about data, this is the information, the facts, the numbers, the stuff that we collect to help us make decisions. When we think about health disparities, when you think about disparities, think about differences. And here it's differences in health among groups of people. So these are the preventable differences in the burden of disease, injury, violence, and opportunities to achieving our optimal health. When we look at health equity, and if you recall, a few weeks ago, we had Dr. Kent Key come on. He did an amazing job talking about health equity and talking about social determinants of health. And when we think about equity, think about ensuring that everyone has the chance to be as healthy as possible. So this is the state in which everyone has a fair and just opportunity to attain their highest level of health. And then social determinants of health. So these are the non-medical factors that influence health outcomes. So think about the conditions and the environments where people are born, where they live, they learn, they work, you go to church, you play, and where you age. And this affects a wide range of health and functioning and quality of life outcomes and risks. So that kind of sets the stage as we move on to talk about how did we put together the health equity report card. So there are other report cards across the US. Blair Warren, who you will get a chance to meet in the next slide, she's gonna kick us off and talk more about the health equity report card. But she did an extensive search looking at a variety of different models of health equity report card. We narrowed it down to 5. So we had some out of Wisconsin, New Mexico, and we presented those 5 models to our community task force. We said, what do you think? And from that 5, we identified one, which was out of Nebraska. And we chose the Nebraska model because it really was the, number one, the simplest, but most comprehensive way to determine what the letter grades would be when we calculated the disparities or the differences. So on the next slide, Blair is going to talk us through more about the Nebraska model and what disparities are.
Yeah, awesome. So the Nebraska model, like Heatherlyn said, it essentially gave us the range that you can see here at the top of the slide, showing the disparity ratio numbers and their associated letter grades. The higher the number, the higher the disparity or difference, essentially. So the resulting number then determines the letter grade for that indicator. Disparity, generally, it means a significant or unfair difference. And the ratio, the disparity ratio, is calculated by dividing the outcome for one group by the same outcome for a second group. And it is essentially then a measure of the difference in outcomes between those two groups. An important point, though, that we want to emphasize throughout the report card is that a lack of disparity or difference does not mean adequate health services, access, behaviors, or outcomes. So, there could be the letter grade for A for a given indicator showing no disparity, and that, letter grade is good, but it doesn't necessarily indicate that there's adequate health services, access, behaviors, outcomes, stuff like that. Yeah. And then overview for the data and where we got it, how we got it, what it is essentially. We found 26 data sources. So those are different sources, such as, the health department, CDC and stuff like that. And we're able to compile 51 different indicators, essentially data points, that we organized into 6 different categories, which are health services and access, socioeconomic status, physical health, mental health, maternal and child health, and health outcomes. We then disaggregated or split that up and organized the data by location and by race. For location, we looked at US, Michigan, Genesee County, and Flint, all through the central lens of comparing Genesee County to those other locations. And then by race, within those locations, looking at specifically those who identify as Black and those who identify as white, and comparing the two populations for those indicators that we could collect data for. And then we also put together some maps, data maps that look at Genesee County as a whole. And this is essentially thanks to Dr. Sadler and Alan Harris as well. And they helped us out with gathering some of the maps and creating them for us. And they essentially there's 6 of them. And in addition to one map that goes side by side with those 6 that show the percent Black of the population in Genesee County to get more of a sense.
Let's jump into the health equity report card. Blair's going to bring it up, but of course, I mean, when you work with great people, you have to include them in your in whatever you're doing. So, okay, here it is. All right, so this is the front cover of the health equity report card. You can find this on our website. Carl has been actively populating the chat, so if you might have already seen it even before we unveil it. So maybe you're following along. So when you open the health equity report card, virtually open it rather, you will see that it begins with just a general overview, what we've already talked about, these definitions, and kind of setting the stage of we're just providing differences. It doesn't give us the full picture, but it gives us more of a picture than what we've had before. And each of the 51 indicators are broken down into location and race. But before we get to that, we also want to remind you of our key. So this is that those categories of A through F and some guides. So if you see an A or a B, keep your eye on it, but for the most part, doing all right. If you see a C, this really keep more of an eye on it, right? So even beyond just watching this particular indicator, when you see something as a C, it means you might need to step in, like something's going on. If there are resources available, if there's a program already existing, you might consider revamping or providing additional resources. If you get into a D and certainly into an F, this is a critical area. This needs to be adjusted. It needs to be stepped in. Yeah.
Heather, Lynn, and Blair, are these disparity ratio cutoffs also based on the Nebraska data? Like, is that how it was determined?
Yes.
Exactly.
Yeah.
Okay. And here's the thing, and EJ, I'm glad you brought this up, because when we looked at some of the others, so you can see that, where does an F start? Some of the others had a larger number, so into a 3 or something like that, but that wasn't enough for us. That wasn't enough for the it wasn't just us, it was our community partners as well. We wanted to make sure that we were capturing as much as possible so that we can direct our attention to the areas that we need to be keen on.
And I appreciate that, because there's some built-in, you're identifying differences, but it builds in some accountability to pay attention, right? You see this number and you're saying, wow, this requires immediate intervention. I need to at least look, understand, and start developing a response to this. And I think that's so valuable. Yeah.
Yeah. And it's critical for funders, right? So, I mean, if we see a particular area is really struggling, like a C, a D, kind of fluctuating, extra resources, extra support to that organization, our wonderful community organizations, so many that we've been able to showcase on the webinar, are out pounding the streets, putting in so much effort, and we really want to support and celebrate the work that they're doing, celebrate the areas where we're seeing improvement, but definitely gear our resources to the areas that need more support.
It's definitely a source that you can point to say we have demonstrated that this area requires intervention. And as our community partners are working together to develop these interventions, they have a crystallized resource that they can identify and point to. So it's really valuable. Thank you.
And tell their story. Yes, exactly. So this is that key. We do list the key on pages throughout the HERC so that it's, kind of front and center. We then move into some demographics to set the stage for what does Genesee County look like? What does Flint look like? There were some new data that came out that tells us that Genesee County is a population of just over 400,000 people, and Flint, unfortunately, is at one of the lowest rates that we've seen in a while, at under 80,000 people living in the city of Flint. We also offer the race and ethnicity data, age, and then dip into some information around disability, health insurance, education, and things like that. On the next pages, we have some fast facts. So this is where, if you want to just I know, I just saw EJ go, what? That's hard to show. But if you just want to look at across all of the 51 indicators, across all 6 of those categories, where are we having the issues? This is where it is. I have to tell you, Blair Warren did all of this. She did the layout, she picked the colors, like the drapes, the everything. She just did such a fabulous job. She's not for hire, she's mine, but we can celebrate her. So we also included the fast facts by race and by location. So this is really accessible, easy.
Can you go backward?
Mm-hmm.
So this is showing Genesee County, children in poverty, child mortality, Flint, teenage births. And I'm highlighting that because it dovetails with what the research symposium expertise is talking about, right? And it's, we already have a community partner who's already thinking about this. It just struck me. So thank you.
Yes, exactly. I know. Well, and then what, I think it was something Danielle mentioned, it was another flag. Anyways, also make sure that you notice that we include definitions throughout the health equity report card. So there's a glossary at the end, but nonetheless, this is really trying to make sure that this is as understandable as possible, because there's a lot to unpack. As we move through the pages, you can see that these are just, again, what we hope is that these are words and phrases that community can just lift off of the page, put it in an annual report, put it in an application for funding, and really tell the story of our community, tell the story of our work. The next page is the official first page of the health equity report card. Blair's going to talk about it, but each of these 6 categories that we've discussed is formatted. So the first page is broken down by location, the second page is by race, and then Dick Sadler just joined us. The third page is a map. So Blair, tell us about health services and access.
Yeah, so as you can see on this page, it's the report card by location. These letter grades indicate the amount of difference between Genesee County and other populations. So it's through the lens of Genesee County. You'll see some of them have an asterisk and some do not. No asterisk indicates that other populations face worse outcomes, while those with an asterisk indicate that Genesee County faces worse outcomes. And you can see, especially in the Flint bracket table part of the table here, is that there's missing data for Flint. A lot of the part of the data collection for us was seeing how much data we wish we could have for Flint, and some of the other categories and locations as well. So there's definitely some gaps still in the data, but this just helps give us a sense and like a framework on where to start.
Blair, I think the gaps tell us something though, right? Like it tells us that we could be doing a better job of getting data, and that there are probably holes in our data sources in this space. So I appreciate even that being a really important, outcome that we can examine here.
Yeah, definitely. Data collection is so important, just to give us a sense of what's going on in the community, and where to improve and what's working well. So as you can see, just to give a kind of high level look at some of this, I know there's a lot to unpack, but as you can see, there's 2 C-level disparities here. So disparity is present between Genesee County and Michigan residents for cost prevented care, and the percent of the population that is uninsured, with the Genesee County residents facing worse outcomes. And then as you can see for the C level, you can look up at the key here again, just to remind you of, what the disparity, what that level really means. And that C level shows that it may require intervention, and essentially means, that's something to monitor and think about. And then in the next page, this is the by race page for health services and access. So the letter grades here indicate the amount of difference between Black and white populations within each of these locations. No asterisk indicates that the Black population faces worse outcomes, while those with an asterisk indicate that the white population faces worse outcomes. So as you can see, there's more C's here. There's also a D level disparity. Racial disparity is present in Genesee County for cost prevented care and preventable hospital stays, with Black individuals facing worse outcomes. And then racial disparity is also present in Genesee County for HIV testing, with white individuals facing worse outcomes. And so these are just some things to monitor and think about.
Yeah.
The next page. Oh.
I was just going to say that. So notice the narrative at the bottom, right? So we want folks to just be able to grab that and stick it. Heatherland, grab the information and use it however you'd like. Use it in presentations. Dick Sadler has been able to join us, our map guy, and I think that you have some points that you want to add to what we're sharing.
Yeah, and I've been on about 20 minutes, but I was lurking. I don't know, maybe you can show up. Yeah, so thank you, Heatherland, for the invitation. And I wanted to share just a couple of really big picture ideas. When you look at these disparities, and again, keeping in mind that these are relative differences. So like Flint and Genesee County have struggles that we see showing up compared to national patterns, but the places where we're getting a lot of Fs often have to do with economic patterns, unemployment, low income, people living in poverty, and especially when we look at Flint versus Genesee County disparities, a lot of those are emblematic of our state's anti-urban policies over the last 70 years. So the same things that caused the water crisis, the fact that we subsidize single family home ownership, we build new water lines. I just read a thing that there's millions of dollars going to new water lines for the suburbs. And it's like, hi, we haven't replaced the water lines in the city that are falling apart. We still have this infatuation with building out and out and out. And because our society is so economically unequal, it means wealthier people get more and more afraid to live in cities. And so their tax dollars go to different municipalities. So a lot of the things driving the Fs, like on the pages, if we could kind of scroll up and down through some of the pages here, you'll notice like this one, socioeconomic status, we have lots of Fs, lots of Cs. There's no As in inequality. These are reflective of national patterns, but also made worse by Michigan being a very anti-urban state over the last 70 years. So that's just one thing I wanted to kind of reflect on, because as a person who works at the urban planning public health interface, thinking about those big upstream policies that we could address if we build in policies at the state level, in particular, since we have an attractive legislature and a governorship at the moment for thinking about these things, start rebuilding cities in an equitable way, stop subsidizing suburban growth patterns so much, it'll actually be cheaper, and we'll be able to build health equity into that dynamic.
I've always appreciated Dick's context for what it means to consider the built environment and how it intersects with this. And you think about anti-urban policies, right? And I follow you. So I think about things like, we even more bike lanes would drive, decrease disparities. And we need to stop having these huge automobiles that sort of insulate us from the world, right? And drive some of these disparities. And I really appreciate that context of thinking about our environments and how those have disparities.
Yeah, and even the way that urban is a dog whistle for Black
American
society, right? You think about anti-urban, and really anti-urban is anti-Black, because that's where a lot of the Black population had been relegated for so many decades.
Right.
So dismantling that anti-urban bias requires tackling this structural racism.
And so we've talked about that before, right? Like you've taught that to my students when we think about redlining and how those things still exist, and how a lot of our neighborhoods on Flint that are historically redlined neighborhoods still have the disparities that we're seeing here, right? And are definitely byproducts of that.
Yeah, and the deliberate disinvestment from white flighted neighborhoods, and even neighborhoods that weren't redlined, but that experienced blockbusting and white flight in the 70s and 80s, very deliberate anti-urban abandonment patterns.
This is we could continue this conversation. And Blair, thank you for walking us through. I'm certain that folks have been, watching for the Fs, unfortunately watching for the Ds. I think we need to come back and kind of dig into this, particularly as we have speakers coming on to talk about each one of these areas. We can highlight it, but I want to also talk about some next steps for the Health Equity Report Card.
Yes.
As we move through our hour here that we've had with everyone. So here's what we're asking. we're asking for you to use the health equity report card. Check it out. Give us feedback. We want to make it the absolute very best resource, most usable, most understandable report card available for folks. We also ask, please promote it. Promote the webinar, promote the health equity report card as well too. And watch for more HERCs, watch for more health equity report cards. We're already working on another one for Port Huron and St. Clair County, focused on substance use disorder. We're excited to bring that to fruition, as well as connect with more opportunities, which includes Moses Bingham, who's our partner from the Community Foundation of Greater Flint, and here with us today.
Moses, thank you so much for being here and for your expertise, and my apologies for not saying your name out loud the first time.
Oh, no worries. Thank you all for the time. And we've been working with a variety of different partners. And Dr. Uphold, I really appreciate the deep dive in terms of the Healthy Equity Report Card. We've been doing some work with the Community Foundation of Greater Flint. I serve as their Director of Special Projects and Initiatives. And with that, we've established, along with the City of Flint, other stakeholders like MSU, Dr. Rick Sadler, Genesee Health Systems, Early Medical Center, WOW Outreach, and many others have been working on and been involved in gun violence prevention. And we've created a network to have a public health approach with a social determinant of health lens to cure violence. Okay, that being an acronym that stands for collaboration, understanding, relatable, and effort. Okay, it takes all of us to be informed about these problems and issues, because we know that neighborhoods most plagued by community violence have higher rates of chronic disease, higher rates of premature death. Okay, higher rates of criminal and legal contact and incarceration, lower rates of educational attainment, higher income inequality, okay, and higher rates of unemployment. So we have centered our work around equity. But for the foundation, we realize that we can't have the equity conversation unless we have the safety conversation. Okay, and so we meet on a regular basis in terms of our prevention network every second Wednesday. However, this upcoming month, August, we're meeting on August 2nd. But if you want to be a part of the network, please email me, and I'll put my email in the chat for those who want to reach out and be a part of the network to help cure violence in our community.
Moses, there couldn't be better parting words, right? Like, we can't address this epidemic without addressing safety first. And I super appreciate that as an ending point. His information will be in the chat. Thank you to all of our wonderful presenters and all the wonderful expertise everyone has provided today. Reminder about the research symposium from HFRCC, a reminder to see us again next week. Thank you so much, and see yous for community health workers here.